Every evening, just before sunset, I take a slow walk to my neighbor's house, a man who defies everything we think we know about aging. Dr. Peter Stevens is 83 years old, still sharp as a scalpel, still seeing patients, and stronger than most men half his age. I've asked him 100 times what his secret is. Genetics? Good luck? His answer always makes me pause. Luck has nothing to do with it, he says. Most people are making small, deadly mistakes without even realizing it. Last week, over a cup of his signature green tea, he shook his head and sighed. You'd be surprised how many people land in the hospital just because of what they're not cleaning properly. At first, I thought he was joking, but then he pulled out a study from Johns Hopkins. 2023, 70% of senior hospitalizations start with preventable infections. That's when it hit me. Some of the simplest things can steal years from your life. Today, I'm sharing 6 overlooked hygiene spots that Dr. Stevens swears by, things that have kept him strong well into his 80s. I've practiced them myself, and the difference is real. The last one? It shocked me, and I guarantee you're not thinking about it. Let's begin. If you've ever wondered why some people seem to age like fine wine, while others struggle with constant health scares, here's a secret. It's not just luck. It's the small, everyday habits that add up over time. Welcome to Wisdom in Abundance. I'm the Wisdom Professor, and today we're diving into 6 overlooked hygiene habits that could literally save your life. These aren't just good advice. They're backed by real medical experts and, more importantly, by people like Dr. Peter Stevens, who's still thriving at 83. So let me ask you, when was the last time you really thought about how you clean certain areas of your body? Are you sure you're covering all the spots that matter? Because missing just one of these could set you up for an infection you never saw coming. Before we get into it, make sure to hit that subscribe button and turn on the notification bell so you don't miss the wisdom and life hacks that can keep you strong, independent, and thriving for decades to come. Now, let's get into it, starting with the first area you might be ignoring, and trust me, you won't see this one coming. Spot 1. Under your nails, also known as the hidden danger. Dr. Peter Stevens once told me, if I could change just one small habit in my patients, it would be how they clean their nails. At first, I thought he was exaggerating. How much damage could a little dirt under the nails really do? Then, he hit me with a fact that made my stomach turn. Studies from the National Institutes of Health, 2023, found that bacteria like E. coli and Staphylococcus aureus, both known to cause serious infections, thrive under unclean nails. Here's where it gets even worse. Every single day, we subconsciously touch our face over 20 times an hour. That means whatever's lurking under your nails, germs from door handles, phones, grocery carts, gets transferred straight to your mouth, nose, and even eyes. And for seniors, the risk is even greater. A weakened immune system means even a small bacterial exposure can turn into pneumonia, gastrointestinal infections, or even sepsis. In fact, Dr. Stevens recalled a case of a patient who landed in the hospital with a severe respiratory infection, all traced back to poor nail hygiene. So what's the fix? It's simple but must be done correctly. 1. Scrub under your nails daily, not just a quick rinse. Use warm water, mild soap, and a soft brush to remove buildup. 2. Keep your nails short. Long nails trap more bacteria. Dr. Stevens always recommends trimming them straight across to prevent ingrown nails, which can lead to painful infections. 3. Pay extra attention after handling raw food, gardening, or using public surfaces. You'd be surprised how fast bacteria spreads from one surface to another. Still not convinced? Here's a wake-up call. Researchers found that even after washing hands, unclean nails still carry bacteria in over 80% of cases. And what's worse? Many infections that start this way are misdiagnosed, leading to unnecessary medications, antibiotics, or even hospitalization. That's why Dr. Stevens, even in his 80s, still follows this 1-minute habit every single day. And let me tell you, from personal experience, once you start paying attention to it, you'll never go back to ignoring your nails again. Here's a game changer. When trimming your nails, always cut them straight across rather than rounding them at the edges. This helps prevent ingrown nails, one of the most common and painful nail infections in older adults. Now this next hygiene mistake, even trained professionals overlook it, and it's closer to your mouth than you think. Spot number 2, behind the ears. Now, tell me honestly, when was the last time you actually cleaned behind your ears? Not just a quick splash in the shower, but really cleaned it? Most people don't even think about it, but Dr. Peter Stevens once told me a story that changed the way I see this overlooked spot forever. A patient, 72 years old, otherwise healthy, came in complaining about an itching sensation behind his ears. At first it seemed minor, but within a few weeks that mild itch turned into red, irritated skin. Then came the burning, then the swelling. By the time he got back to Dr. Stevens, he had developed a full-blown fungal infection spreading toward his scalp. The cause? Years of sweat, oil, and dead skin building up behind his ears, completely unnoticed. And here's the crazy part. This happens way more often than you think. Here's what's happening. The area behind your ears is one of the most overlooked hygiene spots on the human body. It's a perfect storm, warm, damp, and constantly exposed to sweat, hair products, and even residue from face creams. Over time, this creates the ideal breeding ground for fungal infections, clogged pores, and even painful cysts. According to dermatologists, it's also linked to scalp infections because bacteria from behind the ears can spread right into your hairline, causing itching, flaking, and even dermatitis. So, what's the fix? Simple, but consistency is key. 1. Daily wipe down. Use a pH-balanced cleanser or gentle soap to clean behind your ears every single day. If you're on the go, a damp washcloth works wonders. 2. Go beyond the surface. Many people think rinsing in the shower is enough. It's not. You actually need to gently wipe away the buildup, especially if you use hair products or sweat often. 3. If you have sensitive skin, avoid harsh soaps. Dr. Stevens always recommends using a mild, fragrance-free cleanser or even micellar water to remove bacteria without irritation. Why it matters? Think about it. This is a spot that rarely gets fresh air. It stays tucked away, collecting bacteria, sweat, and even tiny traces of shampoo or conditioner that don't fully rinse off. Ever noticed a musty smell behind someone's ears? That's bacteria thriving. And if left unchecked, it can lead to serious skin issues, including painful fungal infections or even seborrheic dermatitis, a condition that causes relentless itching and peeling around the scalp and ears. Dr. Stevens told me this: the smallest changes can prevent the biggest problems. And this habit? It takes less than 10 seconds a day, but can save you from weeks of discomfort. Pro tip. Here's a small but powerful change. Use a microfiber cloth instead of a regular towel. Why? It's gentler on the skin, removes more bacteria, and doesn't cause irritation like rough fabrics can. Alright, now let me ask you, do you actually clean behind your ears every day? Drop a yes or no in the comments below, and if you're brave, tell me when the last time was. Now, this next hygiene mistake. It's so common that even doctors forget about it, and if you've ever had unexplained itching or discomfort, this could be the reason. Spot no 3, between toes. Stop fungus fast. Dr. Peter Stevens has seen it all in his 50-plus years of practice, but there's one patient story that stuck with him because it almost ended in disaster. A 68-year-old man came into his office for what he thought was just a mild irritation between his toes. No pain, no swelling, just a little itch that wouldn't go away. At first glance, it looked harmless, a bit of redness, some peeling skin, nothing alarming. But Dr. Stevens wasn't convinced. He ordered a closer look, and when the tests came back, the results sent a chill down his spine. It wasn't just dry skin, it was the early stages of a foot ulcer. Left untreated, it could have led to a severe infection, gangrene, or even amputation. The patient was shocked. "But I wash my feet every day," he said, and that's when Dr. Stevens dropped the truth bomb. It's not about washing, it's about what happens after. Most people never dry between their toes properly. That's where the real danger begins. Now let's analyze what's happening. The spaces between your toes trap moisture from sweat, showers, and even the air itself. And if that moisture stays trapped, it creates a perfect breeding ground for fungus, bacteria, and dangerous infections. This is especially dangerous for seniors, especially those with diabetes or poor circulation. The Centers for Disease Control, CDC, reports that 25% of seniors suffer from foot infections, many of which could have been prevented with proper hygiene. And here's what makes it worse. You won't feel it until it's too late. Fungus starts small. A little peeling here, a slight itch there, maybe even a mild burning sensation. But if left untreated, it can turn into painful cracked skin that allows bacteria to enter, leading to ulcers, open wounds, and in severe cases, even hospitalization. And guess what? Most people don't even know they have a problem until it's too late. So what's the fix? It's ridiculously simple, but almost no one does it correctly. 1. After every shower, use a clean, dry towel to gently pat between your toes, not a quick wipe, a thorough dry down. 2. Use a talc-free foot powder to absorb moisture and prevent fungus. Dr. Stevens swears by powders with cornstarch or baking soda, natural ingredients that keep your feet dry without irritation. 3. If you have diabetes or circulation issues, do a quick daily foot check. Look for redness, peeling, or tiny cuts, because what starts small can turn serious fast. Dr. Stevens says he's lost count of how many serious foot infections started with something as simple as a little dampness between the toes. And the scariest part? Many seniors never feel the problem happening, especially if they have reduced sensation in their feet. That's why taking 10 seconds to dry between your toes could save you months of pain and medical treatment. One simple but powerful trick: wear 100% cotton socks and change them twice a day. Why? Cotton absorbs moisture better than synthetic materials, keeping your feet drier and reducing fungal growth. Dr. Stevens has been following this routine for years, and at 83 years old, his feet are healthier than most people in their 50s. Now let me ask you, do you actually dry between your toes every day? Or do you just let them air dry? Drop a yes or no in the comments below. Because up next, we're talking about a hygiene mistake that no one ever warns you about. It's not just uncomfortable, it could be the reason behind recurring UTIs and hidden infections. Spot No. 4. Groin area, which can also be a silent UTI risk. Dr. Peter Stevens remembers the case vividly. A 75-year-old woman, otherwise healthy, came into his office complaining of fatigue, dizziness, and mild confusion. No fever, no pain, just a strange sense of being off. Her family thought it was dehydration, but Dr. Stevens had seen this pattern before, and he immediately ordered a test. The result? A full-blown urinary tract infection, UTI. And here's the scary part. She never even felt it coming. No burning, no urgency. Just silent symptoms that could have easily been dismissed as just aging. And she's not alone. According to the Mayo Clinic, over 40% of UTIs in seniors are linked to improper hygiene, especially in the groin area. Most people think of UTIs as a minor annoyance, but for seniors, they can be life-threatening. A hidden infection can lead to severe kidney infections, sepsis, a dangerous blood infection, sudden confusion, dizziness, and falls. And the worst part? Many seniors never feel the warning signs until they're already in trouble. So how do you protect yourself? Dr. Stevens gives his patients 3 simple rules. 1. Use a fragrance-free, mild soap. Anything with harsh chemicals can irritate the sensitive skin in the groin area, leading to tiny openings where bacteria thrive. 2. Rinse front to back. This prevents bacteria from the anal area from spreading to the urethra, one of the most common causes of UTIs. 3. Always dry thoroughly. Moisture and warmth create a breeding ground for bacteria. A quick pat dry with a soft towel can make a world of difference. Here's the reality. A single UTI can lead to months of exhaustion, brain fog, and even hospital visits. Dr. Stevens has seen patients whose lives completely changed because of one unnoticed infection, and most of them could have been prevented. That's why these small hygiene habits aren't just about feeling clean. They're about staying independent, sharp, and out of the hospital. For those with limited mobility, reaching certain areas can be difficult. Dr. Stevens always recommends no-rinse cleansing wipes. They're gentle, effective, and a great alternative when a full shower isn't possible. Even he keeps a pack on hand, because at 83, he knows that staying clean means staying healthy. Alright, let me ask you, have you or someone you know ever had a UTI? What was the first symptom you noticed? Drop your experience in the comments below. It might just help someone else. Because up next, we're talking about the one hygiene mistake that's been silently ruining senior skin for decades. And almost no one talks about it. Spot No. 5. Belly button, always the forgotten zone. First off, if you're still here watching, I want to say thank you. It means you're someone who values your health, your future, and your independence. And if that's you, then you belong here. This is more than just a video. This is wisdom in abundance, a community of people like you who are committed to staying sharp, strong, and thriving in their later years. So if you haven't yet, hit that subscribe button and join the community. Let's keep growing together. Now, let's get into the one hygiene mistake even celebrities have fallen victim to, and why your belly button might be hiding something dangerous. Now, you might be thinking, my belly button? Really? That's what we're talking about? But hear me out. Let's take a quick detour to Hollywood. Back in 2011, famous actor Ashton Kutcher took on the role of Steve Jobs in a film about the Apple co-founder's life. In an attempt to be more like Jobs, he started following the same extreme diet, only eating fruit. At first, everything seemed fine, but then something shocking happened. Kutcher landed in the hospital with severe stomach pain. Doctors discovered that his diet had thrown his body off balance, leading to serious inflammation in his pancreas. So what does this have to do with belly buttons? Just like Kutcher ignored the balance his body needed, most people ignore their belly button entirely. And that little neglected space, it can become a breeding ground for bacteria, fungus, and even infections. A 2022 medical study found that over 60% of seniors' belly buttons contain harmful bacteria, some of which are the same strains found in ear infections and even staph infections. Why? Because the belly button is a deep, dark, and rarely cleaned area, the perfect environment for sweat, dead skin, and dirt to build up over time. In some cases, doctors have actually found yeast infections and even mold inside neglected belly buttons. And the worst part, you won't even notice it's happening until it starts to smell, itch, or cause irritation. Dr. Peter Stevens always reminds his patients, if you clean every part of your body except one, that's the one bacteria we'll target. So here's the fix. 1. Once a week, take a cotton swab dipped in rubbing alcohol and gently clean inside your belly button. If you have sensitive skin, warm water and mild soap work too. After showering, always pat the area dry. Moisture buildup can lead to fungal growth. 3. If you notice a strong odor or redness, that's your sign to clean it more often. Here's a fact that'll make you think twice about skipping this step. Some doctors have actually identified over 2,300 different types of bacteria inside belly buttons. That means if you're not cleaning it, you're carrying around a microscopic jungle of germs, right in the middle of your body. Want an extra layer of protection? After cleaning, apply a drop of coconut oil or aloe vera. It keeps the skin healthy and prevents irritation, especially if you have dry or sensitive skin. And if you're wondering, yes, Dr. Stevens still follows this routine himself. Even at 83, he swears by it. All right, I've got to ask, when was the last time you actually cleaned your belly button? Drop your answer in the comments below. No judgment. Because up next, we're covering the most shocking hygiene mistake of all. A spot that's been silently affecting your health for decades, and no one talks about it. Spot No. 6. Dentures and gums. This can be seen as pneumonia risk. History has taught us that the smallest, invisible threats are often the most dangerous. During the 1918 Spanish flu pandemic, doctors were overwhelmed by a terrifying trend. Many elderly patients were dying, not from the flu itself, but from something else entirely, pneumonia. Their immune systems were already weakened, but what really pushed them over the edge? Bacteria that had been sitting in their mouths for years. Fast forward to 2020, when COVID-19 swept across the world. Once again, seniors were at the highest risk. And once again, pneumonia became the silent killer. But here's what almost no one talks about. Many of these cases could have been prevented with proper oral hygiene. Let me share a shocking statistic. According to the Oral Health Foundation, dirty dentures and poor oral hygiene increase the risk of deadly respiratory infections in seniors. Why? Because every time you eat, drink, or even breathe, bacteria from your mouth travels straight to your lungs. And if you're not cleaning your mouth properly, those bacteria multiply, leading to infections, inflammation, and in many cases, pneumonia. And here's the real shocker. Pneumonia is one of the leading causes of death in older adults. Something as simple as neglecting your dentures or failing to brush your gums properly can make the difference between life and death. Dr. Peter Stevens once treated a 79-year-old man who came in with what seemed like a minor cough. Within days, he was in the ICU, struggling to breathe. The cause? A bacterial infection that started in his mouth. His dentures hadn't been cleaned properly in years, allowing bacteria to thrive and spread to his lungs. By the time he got treatment, it was too late. This is where one small daily habit can literally save your life. 1. If you wear dentures, brush them daily with a soft bristle brush. Avoid regular toothpaste. It's too abrasive and can cause tiny scratches where bacteria hide. 2. Always soak your dentures overnight in a cleaning solution. This removes bacteria and keeps them fresh. 3. Even if you have no natural teeth, your gums still need care. Use a soft brush or gentle mouth rinse to prevent bacteria buildup. Dr. Stevens follows these steps every night. He says, most people think oral hygiene is about fresh breath. It's not. It's about keeping bacteria out of your lungs. Still not convinced? Let's break it down. Dirty dentures increase pneumonia risk by 40%. Poor gum health is linked to heart disease, strokes, and cognitive decline. Many seniors lose their ability to taste properly simply because of poor oral hygiene. And here's something most people don't realize. Denture-related infections can also cause severe weight loss and malnutrition because they make eating painful. This isn't just about staying clean. It's about staying alive, staying independent, and staying strong. Want to take it a step further? Try massaging your gums daily. This boosts circulation, keeps your gums strong, and reduces irritation from dentures. It's something so small, but according to dentists, it can prevent big problems down the road. All right, be honest. Did you know that unclean dentures could lead to pneumonia? Drop a yes or no in the comments below. Now let's wrap this up, because if you made it this far, you're already ahead of most people when it comes to protecting your health. All right, now I have to ask you, which one of these hygiene spots surprised you the most? Be honest. Drop your answer in the comments below, because trust me, there are a lot of people out there who have no idea about some of these risks. And here's why your comment matters. The more we talk about this, the more we help others catch these mistakes before they turn into real problems. So if you've learned something new today, don't keep it to yourself. Hit the like button to let us know you're finding value, and share this with your family, friends, or anyone who needs this information. You never know, you might literally be saving someone from an unnecessary trip to the hospital. And here's a fun fact. Did you know that keeping your hygiene in check can actually boost your immune system? Yep. Studies show that small habits, like proper hand washing and daily oral care, can reduce your chances of infections by over 40%. So if you're serious about staying independent, healthy, and thriving, stick around, because we're not done yet. The last tip I'm about to share, it's the one mistake that even doctors forget about. Let's keep going. At the end of the day, it's the small daily habits that add years to your life. Just think, how many seniors have suffered needless hospitalizations because of tiny avoidable hygiene mistakes? But not you, not anymore. Because now, you're armed with knowledge that can protect your health, your independence, and your future. So if this video helped you even a little, do me a favor, hit that subscribe button and turn on the notification bell so you never miss out on science-backed health hacks designed to keep you thriving. And here's one last thing. If you know someone who might need this information, share this video with them. Because sometimes, one simple tip can change, maybe even save a life. I'll see you in the next one. Stay strong, stay wise, and remember, you're in control of your health.